You are listening to the Motherhood Unstressed podcast, and I'm your host, Liz Carlisle. Thank you so much for tuning in. I am so glad that you're here and that you're spending your week with me, a little time out of your week. And I'm just back to Georgia after spending some time with family up in Virginia. And the visit wasn't for necessarily a happy reason. Many of you know my older sister has been struggling with triple negative breast cancer for a few years now. And so, anyone who is familiar with that type of cancer knows it's a very aggressive cancer. It's more common in younger women. And so for her to have been doing as well as she's been doing for the past couple of years already is a success. But I wanted to spend some FaceTime with her and hug her and, just be there with her and the rest of my family. I have a lot of family up there as well. And it was just such an amazing time. As hard as it was also just incredible, and I'm so grateful for that time. And I think, honestly, that's part of the reason why I focus so much on health and wellness, why I've become so obsessed with nutrition and wellness in general, is because it's affected my family so deeply. And anyone listening, cancer is just so incredibly common nowadays than ever before. And that's why my show this week was so important to release. I thought it was a very timely episode. I am speaking with the amazing Dr. Bindiya Gandhi. She is a double-boarded physician. She is boarded by the American Board of Family Medicine as well as the American Board of Integrative and Holistic Physicians. So she's not just your standard Western medical doctor. She also incorporates a lot of Ayurvedic medicine and a lot of Chinese medicine as well. And this is an episode where we're talking about chronic stress and what's going to be most important to you, the listener, what you can do to safeguard your health, to mitigate the effects of chronic stress in your life. So I hope you enjoy this episode. If you do, please share it with a friend. Please leave us a review on Apple Podcasts. That does so much for the show. And enjoy the episode with Dr. Gandhi. Hey guys, I want to talk about show sponsor Hiya Vitamins. This is the company that was started by two dads, and it was because they were tired of all of the other vitamin companies out there who were selling vitamins to children under the guise of healthy nutrition, but they were packing them with sugar. And we all know, if you've done any basic study on sugar and health, it destroys the health of the gut. And it actually causes immunity issues. So if you eat too much sugar, you're going to get sick more. And any benefits that you think you're getting from your vitamin are completely negated. So this is a company that uses 12 essential vitamins and minerals from plant sources that's going to actually help your children and get them what they need to be healthy. So if you're interested in trying them out, we've worked out an exclusive offer with Hiya Health for their best-selling children's vitamin. This is just for Motherhood Unstressed podcast listeners, and you receive 50% off your first order. To claim this deal, you must go to hiyahealth.com/unstressed or enter the code unstressed at checkout. That's hiyahealth.com/unstressed to get your kids the full body nourishment they need to grow into healthy adults. Full discount is applied at checkout. Well, hello, Dr. Gandhi. Welcome to the show. I'm so glad that you're here. I know how busy you are. I know, this is kind of a crazy time in the midst of COVID. So welcome to the show.
Thank you, Liz, for having me.
Yeah. So kind of just to get our listener up to speed with you and all of the work that you're doing, take us through your journey to functional medicine. Why was this particular field so attractive to you?
So I found out I had celiac, and it was literally my own journey that was the reason why I wanted to, help other people. Because if I was going through all of this, then I know other people were going through this as well.
Yeah, absolutely. And think, with modern medicine, with everything that we can offer today, it's really surprising to me that most doctors don't dig deeper. They're not testing. They're not doing all this extra work because it is time consuming. Why do you think that is, besides the time factor?
So I know in my world, like in medical school, I always say this, doctors are taught disease management. That's what we're taught, right? We're not really taught nutrition. We only spend actually a whole hour in 4 years of medical school. Wow. So the focus really is heavily on pathology, which is disease, and pharmacology, which is the drugs. So that's why many doctors, they don't know where to start, right? We're just taught a certain way. And that's all doctors know. In their defense, that's all they know. I tell people this story all the time. Like, I was in my pharmacology class, and my pharmacology professor was telling us about high blood pressure medication, amlodipine. And so he was like, yeah, one of the side effects of amlodipine is, leg swelling, but it's not really a side effect. That's the mechanism of action. That is what's supposed to happen. Inevitably, at some point, they're going to experience this side effect, but it's not a side effect. It's eventually, inevitably going to happen. Wow. And so that, again, was another early on sign where it was like, no, this is not what I want to do. So I'm going to give them a prescription for high blood pressure. And then they're going to come to me 2 weeks later or whenever saying they've got leg swelling. Now I've got to address that and give them another medication. So I prescribed to them 3 different medications for one thing. It doesn't make sense. It's just the way the medical system is, and it's not the best system. And that's where, functional medicine and integrative medicine has spanned about, because there's a lot of people that realize there's another way, and we can provide patients a different resource.
That's so incredible. And it's so encouraging to know that there are people like you out there doing this work day in and day out, and like coming on shows like this to spread the message far and wide, because I can't tell you how many people I talk to and they feel like when they go to the doctor, they're not heard, or, they can't really speak up for themselves. And they're just listening to the doctor, and that's it. They don't question. They don't say, wait, there's more to this rash than.
Yeah. And this is why patients become their own advocate for medicine, and this is why I encourage patients to, if they're not getting the answers from one doctor, go to another doctor.
If you're like me and you adore a calming glass of wine at the end of the day with dinner, then I'm really excited to tell you about this new company that's sponsoring the show called Usual Wines. Now, it's not just because they don't add sugar, which they don't. It's not just because the wine tastes fantastic, which it does. My favorite thing about this company has to be that they package it in these 6.3 ounce individualized bottles per box. What that means, ladies and gentlemen, is that there's no more wasting beautiful bottles of wine because you didn't drink the whole bottle in one sitting. You literally open a bottle, pour it in, and you're good to go. And if you want one, open another one, but you're not putting a cork in a larger bottle of wine and then the next day it doesn't taste as good, because I can't tell you how many times that's happened and how soul-crushing that is, because you want to have, the same taste the next day and it's just not there. So Usual Wines has completely hacked that. I think it's brilliant what they're doing. And the wine, again, is no added sugar. They harvest it at just the right time. A lot of wine companies harvest it too early, so there's all this added sugar involved. They don't do that, and it's straight out of Sonoma County, so it's good. So be sure to go check out their website at www.usualwines.com and use my discount code UNSTRESSED for $8 off your first order. Absolutely. So for the people coming into your practice, what's primarily the reason? I know you deal with a lot of women's health and things like that. What usually gets them through the door?
I am a family medicine doctor at the end of the day. So I see, kids, I see adults, I see geriatric patients, so all ages, babies. Majority of my patients seem to be a lot of autoimmune issues. I see a lot of thyroid health. I see a lot of patients with fertility, a lot of helping people get pregnant. At the end of the day, I still see a little bit of everything.
Absolutely. And so how much of yours training in Ayurvedic? Because I find that this field is completely fascinating and so much knowledge is in these old teachings. How much of the Ayurvedic medicine do you bring into the functional medicine, or is it all kind of interwoven?
It is definitely interwoven. I always like to tell people I'm not an Ayurvedic practitioner. That's not all I do. Yes, I have some training, but I'm not like a certified Ayurvedic practitioner. But I do incorporate some of the modalities, especially when it comes to like herbs and treatments, especially when it comes to like stress management, incorporating some of the yoga in there, the mindfulness, the meditation. So that's kind of where I incorporate a part of the Ayurvedic. Ayurveda is very complex. So with some people, I know what kind of personality types they are, because the 3 main are like Vata, Pitta, or Kapha, but I'll incorporate a little bit of that in their treatment protocol. So I definitely take a very individualized approach with patients. It's definitely like I have a tool bank, and I use a little bit of Chinese medicine here, I use a little bit of Ayurveda here, I use a little functional medicine here. It's basically meshing all that together and like giving that to the patient that fits them well.
That's incredible. And I was reading on your bio, you're certified to do Reiki. You're certified in yoga. I mean, I've never seen any doctor out there doing what you're doing. And then I read that you studied with Dr. Weil, who is just an amazing person. I went to the Institute for Integrative Nutrition and he was one of the lecturers and he's just incredible. So talk to us about your experience with him, working with him.
You know, he is super cool. He's definitely been one of my mentors in my adult professional life. He practices what he preaches. He is so humble. I tell everybody he lives out in Tucson with his animals and he grows his own food and he cooks his own food. Like he's the father of integrative medicine. And you would think that, you know, you look at him and he's just like this humble, sweet old man. That's really what he is, you know, but you have this persona of, you know, he owns True Food Kitchen and he's so successful, right? Like, he owns True Food Kitchen and the whole origin line is because of him. And he has like the supplement line. He does so much, but he's so humble and he's so sweet and he's so knowledgeable. And he's been doing this for years. You know, he's been doing this since the 70s when people thought he was a quack, you know, and like people were like, what are you talking about? What is this lifestyle medicine? But he was persistent and he was like, no, there's something to this. And now look at him. He's built an empire from it and it's wonderful. And he's trained so many people, including myself. Yeah.
That's awesome. So talk to us a little bit about, you know, you said that you bring in all these different elements for the listener who wants to start, I don't know, feeling better, boosting their immune system, especially right now. What are some herbs that they can take? You know, obviously it's bio-individual, but what are some things that they can start incorporating?
So for all this crazy stuff that's going on right now, first things first, you know, if you're able to get your vitamin D checked, get it checked because everybody needs to have a little bit of vitamin D. Vitamin C right now is probably more popular than it ever was. Studies show that vitamin C really does decrease the duration of a cold and flu. And when first of all, as we age, antioxidants in our body start decreasing. And as we age, you know, our vitamin C level starts getting lower. And this is why when we're older, we're more susceptible to viruses, diseases, anything like that, right? And not just as we age, but if your immunity is not that good, right? And because you have less vitamin C, this is why you tend to get sicker. So vitamin C is definitely a good supplement to add. You know, I'm a big fan of adaptogens. I'm a big fan of ashwagandha. That's something I take all the time too. Stress reduction is so important right now because stress is coming from us from different places. Like we've got kids, we're working, we're trying to establish this new normal that many of us are going through right now. Our sleep is off, like just a lot of things, and just balancing your mood is another great herb, you know, another great herb to add. So definitely top 3. What else? If I could add one more, probiotic, gut health. Majority of us have gut issues and don't even know it, you know, and again, in Chinese medicine and Ayurvedic medicine, all diseases start in the gut. So we have to keep our gut healthy. Most of us, and I'm guilty of this too, when I'm home, I'm probably eating a lot more. I'm probably snacking a lot more because I'm giving my kids snacks and then I'm snacking with my kids.
And they're always eating. This episode is brought to you by Let's Get Checked, the leading provider of at-home health tests. Are you looking to improve your hormone levels? With Let's Get Checked, you can do a simple at-home health test that will give you a complete picture of your hormonal health in just 5 days. Female hormone function is an important part of our health, and some of the main symptoms of thyroid imbalance, which is so common for so many women, includes weight gain, fatigue or feeling tired all the time, mood changes, skin rashes, and headaches. So how does the process work? Well, your test is delivered straight to your door. You just have to self-collect your blood sample from the tip of your finger. You mail the sample back to their accredited lab with the prepaid label, and you receive support and guidance from the Let's Get Checked medical team. And they're available 24/7 to offer you the personalized advice that you need to know your hormonal health. And this week, Let's Get Checked wants to invite you to join their community with the 30% discount code UNSTRESSED30. That's something that's really good to know. So just go to letsgetchecked.com and use my code UNSTRESSED30 and find out what is going on with your body so that you can make the best decision for your health.
I feel like we're always eating, or at least I'm always eating. So things like that, just making sure your gut is in check, because again, your gut is part of your immune system, and the healthier gut you have, the less likely you'll get sick and the better immune system you have. So if I had to pick, those would be my 4: vitamin C, vitamin D, ashwagandha, and probiotic.
I love that list. I really, really do. I've always been a huge proponent of probiotics, ashwagandha. For people who have cancer, would you suggest them adding in a large amount of vitamin C or just a regular size per day?
No, actually, we do some cancer therapies. So people that are going through chemotherapy, they'll also come to us and we'll do IV high dose vitamin C therapies for them. And that's just the same reason why, because when they're sick, when you're older, when you're aging, that vitamin C, that antioxidants depleted so much and so rapidly that we have to replenish it.
Okay, that's really good to know, because I feel like so many people who are going the traditional route, my sister has cancer, she doesn't know this, and it's like, oh, well, I don't want to add in anything else because it might mess up with my treatment, my chemotherapy, but it seems like this is something natural that your body needs.
A lot of people are scared. A lot of people don't know the data. And then conventional medicine, so maybe you're a hematologist, oncologist, they don't know the information. They don't know integrative functional medicine world. So if your sister were going to mention, hey, I heard that vitamin C may help while I'm going through chemotherapy, they may be like, what are you talking about? No, I don't know, right? But that's, again, in their defense, they weren't taught this way. They didn't spend the extra couple years doing functional medicine, integrative medicine to learn all this. But I mean, I definitely recommend it to people, Again, one of the things I like to stress is I am a medical doctor first. Integrative medicine is me combining the conventional world with the holistic world. And this is where we make the best decisions, because we're incorporating everything, and we're getting information from science and from different modalities in different ways.
Yeah, but I think that that's really what gives legitimacy to the work that you're doing, because you have had the conventional vetted training that Western society respects, and rightly so. But you also have exposure to all of these other modalities, which have been proven to work for thousands of years. Yeah. So what's your thought on, the responsibility of other medical doctors to at least have a baseline education on this stuff, whether it's on their own or not, so that they can fully help their patient?
Honestly, I'm hoping maybe in the next 10 years that medical school starts incorporating this kind of stuff, at least basics. I know some residency programs are already incorporating some integrative medicine in. So give us 10 years, and I think the new next generation wave of doctors, it's naturally going to be ingrained in them, because this is the future. There is science to Chinese medicine. There is science to Ayurvedic medicine. There is science to vitamin C. There is science behind nutraceuticals and supplements. And we just need more people doing more trials. And once we have more data, again, this is what people want. People are demanding integrated functional medicine. People are wanting it. So people may be just hearing about it now. This may sound like a new thing, but this has been going on for at least 30 years. It's just now becoming more mainstream.
Absolutely. You're right. And I think too, if the pharmaceutical companies see that there is a demand, and whether or not you can patent vitamin C or not, I know that's up for debate. Then hopefully more studies will be funded. And so,
and unfortunately, pharmaceutical companies have the big bucks, and so they can fund all these studies. Where probably like hundreds of different small supplement companies that can sell vitamin C, but they're not big enough to put out a big vitamin C study. So,
right. Absolutely. Oh, I didn't think we were going to go there, but I love it. No, this is great. I think it's been a really well-rounded coverage of health and functional medicine. If there were one takeaway that you wanted to leave the listener with today, what would that be?
Just because of everything going on, is my biggest take home, and that I tell everybody, is if you don't take care of yourself, and if you never control your stress will take care of you. Will take over you, basically. Mm-hmm. And so not just during this whole COVID-19 nightmare, but in general, we have to learn how to take care of stress, and we have to learn how to manage our stress, because this, to me, stress is the number one reason why we develop gut issues, why we develop cancers, why we develop heart disease, why we develop autoimmune conditions. And it's chronic stress over time. It's not just, a small thing. But COVID-19, this is a perfect example of this is going to turn into chronic stress. This starts off as a small thing, and this can have ramifications for 6 months, for years to come. And this is going to turn into chronic stress. So, I have my own suspicion of what's going to happen after all of this is done and over with. But one thing I will say is, guys, for anyone listening, if you have time right now, take this time and this opportunity to develop some good routines, some good lifestyle habits that you can carry on when we're out of this mess, that you can stick to and you can do and you can adhere to, because honestly, that's what's going to take you far. Yeah.
I love it. Such truth. So for our listeners who want to find out more about you, if they're in Atlanta, work with you, where can they find you?
Our office is called Revive Atlanta MD, and we're located in Decatur, Georgia. My website is drbindiamd.com, and then Facebook / Dr. Bindiya MD.
You have been listening to the Motherhood Unstressed podcast, and I'm your host, Liz Carlisle. Thank you so much for tuning in. If you love this episode, please share it out on your social media, Instagram stories, and tag us at Motherhood Unstressed so we can share it back out and keep the conversation going on these important topics. Also, make sure that you subscribe so that you never miss out on an interview with an amazing guest or our weekly guided meditations every Wednesday. This episode is sponsored by Motherhood Unstressed CBD. This is my line of organic, USA-grown hemp that was specifically designed to help you, the listener, battle stress and anxiety naturally. And what CBD does is it helps your body's own endocannabinoid system function better. So you're sleeping better, you're experiencing less stress and anxiety, and you're able to get everything done with an overall feeling of security, of groundedness, of calm. So if you would like that in your life, head on over to motherhoodunstressed.com, click the shop tab, and use the code podcast to save.